Good morning, and welcome to our continuing series on homeopathy with Dr. Pachegaonkar. Namaste. Today we have the subject of incontinence. Affects many people. Where shall we start?
Yeah, incontinence exactly means lack of control or like urine, passing
Yes, yes.
urine, and even bowel movement, even the stools.
Oh, I see.
Especially in males, elderly males, the prostate enlargement can give rise to this sort of ailment. Though there are so many other factors also.
Oh,
Mainly in that what happens, the sphincter of the bladder loses tone, and it can be secondary to infection, it can be secondary to some other inflammations, or it can be sort of a paralytic weakness. But this is very common condition. Mainly in males, it is caused by enlarged prostate, especially the median lobe giving pressure over the bladder. But even in females, we have observed this incontinence of urine. Basically, the people who are having tendency to allow their bladder to be over bloated, like even if the bladder is full, they don't pass urine quickly, then the bladder muscles are over bloated,
oh,
and then they go into sort of what we call a transient paresis like condition, where the muscles become weak and the person is not able to get good stream, the strong current. And if this continues, then the person goes on straining and trying, and therefore the incontinence comes.
so one should urinate frequently.
Promptly, not necessarily
promptly,
frequently, but at least
promptly.
one should not withhold it longer.
Okay.
We won't say, like there should be like 15-20 minutes buffer time must be there if one has urge to urinate.
Okay.
But not like you should ignore it for hours. And that causes over bloating, and then the overstraining also. And there are some conditions where the muscles lose the control. It's a neurological condition. So both ways, they just can't have a strong current because of the lack of tone in bladder muscles. At the same time, they can't control it.
Are
It
there
escapes.
palliatives or a cure in homeopathy?
See, in homeopathy, the treatment is very simple. We don't try to work out the pathology and try to deal with the local symptom. We consider it as a one component of the totality. For example, we have a wonderful drug called causticum. Causticum is a potassium salt in potentized form that has given rise to incontinence in even healthy individuals, even young individuals. But the modality is matched. Sometimes if the person say like gets urging for urine and gets up, the very standing up and walking movement gives rise to passing urine, and that is incontinence. There are some instances where if the person is sneezing or even laughing, the bladder gives away, the sphincter gives away, and one passes urine. So these are the instances where causticum is very much useful. With a typical modality that the person, if he is sitting, there is no problem. He has just a simple urge to urinate and he can control. The moment he starts walking towards the toilet or bathroom, he starts passing urine. So these are the modalities which indicate causticum. So in homeopathy, we have wonderful remedies like Staphysagrida, causticum, where the incontinence is taken care of. But mainly what we advise is like healthy maintenance of urinary tract. Healthy maintenance in the sense, first of all, there should be a good proper flushing of kidneys and bladder. If the urine is like too much concentrated, suppose one is dehydrated and drinks less water, so that definitely there would be a concentrated urine, and that concentrated urine, if it is like, because bladder is not full, one won't pass urine so frequently in dehydrated conditions, and there the stagnated urine, it gives inflammation to the mucosa of the bladder, and this inflammation definitely causes irritability. Again, so frequent urine, and sometimes the irritability is such that person even can't reach the bathroom, feels like passing, so irritable it is more frequently, and especially at night. Because of irritability, the person can't get up and go to the toilet for passing, so in between he passes. In between, if he starts walking, again the movements also aggravate this incontinence. So it is better to drink water in time, so that the urine is not that concentrated. So the management would vary from how the condition is appearing. So in elderly people who have the prostate enlargement, we actually give them pelvic floor exercise. What we call after delivery also we advise this sort of a pelvic floor exercise, where the person is asked to constrict the pelvic floor and then relax it and constrict. So this sort of a 5 minutes exercise strengthens the bladder muscles. Moreover, we advise one exercise where while passing urine, we advise the person to withhold it for few seconds. Once withheld, again release it. Once the current starts, again withhold it. So this gives wonderful exercise for the bladder and the sphincter especially. So that actually helps in controlling the bladder, and person can gain it. But the best way is to drink enough water, flush it properly so that inflammation of the bladder mucosa also goes off. Then the enlarged prostate, especially the median lobe, is pressing over the bladder, and that causes irritability. It can cause retention as well as incontinence, both in some people. So it's mainly the neck of the bladder or the sphincter of the bladder which has to be toned up properly, the musculature, and once that tone is good, the person can control. Similarly, there are some instances where bowel incontinence also is very common. We have some cases where the person feels that he is passing flatus, and instead of flatus he passes fecal matter, stools. So that type of incontinence, especially in children who are a bit more nervous, is really a very agonizing symptom. That someone like passing flatus would be a common phenomena, and one won't look for some toilet or something for passing flatus, and along with the flatus the stools escape. So that sort of condition also homeopathy can treat.
What about women? Because women do have incontinence also.
Yes. Women especially, that is what I said, the pelvic floor exercise we advise in females also, because after pregnancy or during delivery they develop urinary incontinence. So we advise them pelvic floor exercise routinely after the normal delivery. After 15 days or so, we advise females to go for pelvic floor exercise, and that really strengthens.
And how many seconds do they contract and hold and then release?
It is like they need not hold. They just contract slowly, and once it is contracted fully, again released slowly. This is very simple pelvic floor exercise.
Yes.
And about like 10 minutes a day should be enough for it. So even females can overcome this incontinence.
Now you had said there was something else.
In incontinence, we have some cases where the children, especially the nocturnal incontinence, we call. The children pass urine in bed.
Yes, we
It's common
all known
condition.
that common thing,
Common.
wetting the bed.
But then in that, what we work out is there are some children who sleep is so deep that they can't be awakened because of urging for urine, and they just pass urine in that. So there we have remedies like natromore, sepia, like remedies, where in deep sleep they pass urine. There are some children who, if they get urging to pass urine, they get a dream as if they are going to toilet and passing urine, and later they realize that the urine is cleared in bed itself. So depending upon that, we have some remedies. But one common management we advise to the parents is, see, the child has to drink lot of water before going to bed. But if the child takes water after dinner, the emptying of stomach will take at least 2 hours, because the food has to churn in stomach for 2 hours, and then body starts getting fluid after 2 hours, and then the urine will be formed. And naturally you don't expect like 3 or 4 year old child getting up because of urine urging and then going to toilet. So what we advise is, first of all, keep like 2 hours gap between going to bed and dinner, and half an hour earlier we have to hydrate the child with ample of fluid water.
Before sleep, before going to bed.
No, before dinner.
Before dinner.
Before dinner.
Ah.
So their dinner should be 2 hours earlier to the time of bedtime,
Okay.
and half an hour earlier to dinner one should give lot of fluid. So whatever like flushing is there, it would be before going to bed. So once the child passes urine before going to bed, then till morning the bladder need not be full. So like 8 hours, 9 hours sleep, the one bladder has capacity of like 400, 500 ml, up to 400 to easily it can accommodate. So that should suffice for whole night, that capacity. So what we advise parents is, give ample of fluid for say 1 hour before dinner. So in one go child won't be able to take lot of water. So we advise that in half an hour in any form, either it can be a juice or it can be plain water, but ample of water if it is given before dinner, and then after half an hour if the child is allowed to take dinner, the body is hydrated properly, because on empty stomach water disseminates very quickly. And before bedtime the whole urine formation, every clearing is there, so doesn't matter, twice or thrice child may pass urine before going to bed after dinner. But once the bladder is emptied, then till morning one need not worry. So this way we, at least 50% cases of incontinence of urine, nocturnal incontinence during sleep, we have cured only with this management without giving any remedy.
What about frequent urination, let's say 3 times in the night, in children and in adults?
See, especially in the males or even in adults, this frequency of urination is not because the person is secreting more urine, the system is like creating more urine, but it is mainly the irritability of the bladder. In normal course, the average capacity of the bladder would be around 400 to 500 ml. And in some people, if the mucosa of the bladder is inflamed, like subclinical cystitis, there the capacity of the bladder to hold urine is poor. Like even with 150 ml, the person starts getting urging and gets up and passes urine. This is one condition where the irritability of the bladder is responsible in frequency. In males especially, if the median lobe of the prostate is enlarged, that gives push. In that case, the person cannot pass complete urine from the bladder. The voiding is not possible. So what we call post-voidal residual urine, and in some people like 150 200 ml is the quantity which is the residual urine after passing urine. So bladder is not emptied completely. So if it is like 300 volume, and in that the person can pass only 150 ml, and 150 ml remains as a residual urine in the bladder, and therefore one has to go on passing frequently. Then this stagnated urine in the bladder, that causes irritability, so irritability also adds to frequency. So that's what we say, it is sort of a post-voidal residual urine volume has to be measured. Now because of the sonography it's easy. We just measure the full bladder and then we ask the person to empty it, urinate, and then again check. So up to, if it is like 10 to 15 ml, it is common. But
to remain.
if it is
That
to
remains,
remain,
yeah.
to remain. Otherwise, if it is like about 15 ml, we have seen cases where like bladder post-voidal residual urine is more than 200 ml. Because of the enlarged prostate or even the paresis of bladder muscles. And there also again there is a management where we give remedies for prostate enlargement and then strengthening the tone of bladder muscles. Both ways it helps.
So that same
exercise. One is pelvic floor exercise and one is for bladder while passing urine. So we advise person to withhold it and release it at least 4 to 5 times in one urination, once a day. That really strengthens it. We have brought like residual urine, like initially the person had residual, post-voidal residual urine up to 150 ml. So in the course of 2 months of treatment and management, of course with this exercise, it has come down to normal, below 15 ml.
So in an 8.5 hour evening, how often should one urinate?
Night time, if like elderly 7 hours, 8 hours sleep, before going to bed and only on waking up, this is normal. This is normal. Yes. Okay. Getting up even once is abnormal. But as a rare case, it can happen because if you have consumed more fluid post dinner, then the urination will be late. And therefore it's fine, like once in a while if someone is getting up in between. But otherwise normally is before bedtime and after bedtime.
Wonderful. Anything to add? Well, have we covered it all? Wonderful. Thank you, sir.